And that's when I realized I've done everything else, and the only other option is to do it for myself. And that was what pushed
Yeah.
me over the edge and fueled me, right?
Hello, everyone, and welcome to Ryan Reflects. My name is Dr. Ryan Corte, and today I'm here with a good friend and colleague, Dr. Hardeep Kataria. And Hardeep and I actually had the opportunity to meet in person as of recently. She has family here in Western North Carolina. Her sister's here. We grabbed coffee. I met her husband, and she's just a very impressive person and optometrist and individual. Welcome to the show, Hardeep. How you doing?
Thank you so much for having me, Ryan. I'm doing very well, and congratulations on the launch of your podcast. This is really exciting. I'm really happy for you.
Thank you. Yeah, it's one of those things that, I think we all have things on our radar for a long period of time, and it's just like, why not? The timing kind of aligned, and I said, let's do this. So thank you for being on the show. But, for those who don't know a lot about you, give us a little bit of a rundown, a little bit of just like an introduction of who you are and a little bit about your journey.
Sure. Okay. So I am originally from London, England, and I moved out to the East Coast, did all my schooling, training, etc. And then I moved out to California for a teaching position, and I was hired from there by a retina specialist to do medical glaucoma management, essentially. And I remember when I was initially hired by them that I said, I'm not interested in anterior segment. I don't want to do dry eye. I'm strictly glaucoma. I love retina. I love everything at the back of the eye. What's the front of the eye? What is that even? And and from my glaucoma clinic and 7 years of doing that was born an anterior segment specialty clinic where I was really in the weeds with ocular surface disease management, neurotrophic keratopathy, pain cases, post surgical pain cases. And then I decided, you know what, let me do this for myself. And 2 years ago, I opened my own cold start dry eye practice just north of LA. And I've just been full steam ahead with that practice ever since.
Yeah, and I can tell by your accent, obviously, born and raised. You said over in UK. Was it London, UK?
London, just outside of London in
London.
Windsor. Yeah.
Wow. That is awesome. So how old were you when you moved out this way? Or was this a post, undergrad, post high school move, or what did that look like?
In the middle of high school, it was really tough. So I didn't enjoy it. It was very difficult. I have three other siblings. We're all 1 year apart. You mentioned one of my sisters already, who's a year younger than I am. I have a brother who's 2 years younger. I have an older sister who's a year older than I am. So we sort of banded together and we really found support in each other when we moved because we felt quite lonely. I mean, coming across the pond, as they say, coming across the
Yeah.
Atlantic Ocean, we're speaking the same language in England as we are in the United States, but honestly, the culture felt almost like we were speaking a different language. And in high school, having an accent and also being Indian and not really understanding what the SATs are and the PSATs are and understanding the school system honestly just felt like we were very lonely. And luckily my sisters and I, we were 11th grade, 10th grade, ninth grade, so we all started in the same system, in the same school. And my brother was in middle school, which is even more difficult because he didn't have the support that we did, where we would see each other during the lunch hour. And so it was actually a pretty difficult adjustment, I would say. Having said that, I'm now look back at it, and we've been here, I don't know, maybe 22, 23 years in the United States.
Wow.
And I'm really grateful because I feel that we were presented with opportunities, maybe educationally or otherwise, personally, professionally, that maybe we wouldn't have had access to if we were in the United Kingdom. Um, and what we did with those opportunities, pursuing fields of healthcare and, for me specifically in optometry, and then, figuring out the specialty of dry eye. I feel like those opportunities that we were presented with were very unique and very special. And I'm actually really grateful for it now. I don't know if I necessarily would be doing the same thing if I were over there. And then also personally, I felt like I really grew just being in a much larger sort of, I don't know, maybe more diverse pool of students in the United States versus when I was in England. So I'm grateful for it, and I think I have become a different person than I would have if I had stayed over there. And I love being here now. I couldn't imagine it any other way.
Well, it's, a few things, just the fact that you made that move during high school. It's hard enough to like change from one city or county or state, but to go across the pond is like a whole different, it had to have been a whole entirely different experience. And it's interesting too, because I feel like I get a lot of messages from international optometrists wanting to come and practice here. And we know that optometry in the United States is very different than it is in other areas of the world. Have you ever thought about that? Like if you went into optometry school and you ended up practicing in your hometown and or another country?
I have thought about it, and I feel that the opportunities that we have here are just so vast that we can take
Hmm.
optometry in so many different directions, and I feel really blessed that we can do that because I don't think that would be the case in other countries.
Yeah, we're a legislative profession for sure. And so you got here, it was mid high school. So you went to undergrad and then you went to optometry school. Where'd you go to undergrad and optometry school?
University of Florida, go
Okay.
Gators, and
Go
then
Gators, right?
and then the New England College of Optometry in Boston, so NECO, and then residency at the Baltimore VA.
Okay. So you like to hang out on the coast. You went from
I,
one coast. And then how in the world did you end up in California after that? Like, what did
so
that
I
look
was
like being all East Coast?
Yeah, it's I always joke. I know what's on the east coast of the country, I know what's on the west coast of the country, and then I get a little confused when it comes
In the
to the
middle?
middle of the country. Yeah. But I don't feel
Oh,
so bad because some of my friends who grew up in the United States still don't know where all the states place in the middle of the country. So I don't feel so bad. But I was offered a position out at Western University in California, and I
so that
wasn't
that that drew
really
you out there. Okay.
yeah, and I wasn't really finding my footing when I was in. I actually after residency, I went back to Florida to practice,
Oh,
and
okay.
interestingly enough, I was so unhappy with the different sort of positions that I had explored in the 1 year after residency that I applied for medical school, and then I was accepted, and I thought I was going to go back to do ophthalmology and specifically retina.
Wow.
Yeah. And then when I got accepted, I don't know, I think it really hit me that, I've got 9 more years of this and I'm not really sure if this really the route that I want to take. And then just within a few days of being accepted, I was offered a position at Western, and it was across the country, so there was a lot of decisions to be made.
Yeah.
And I decided, of course, to stay within optometry and give education a chance because that was really the one mode of practice I hadn't explored in that 1 year. And I was feeling just very dissatisfied and impatient in a sense that I wasn't finding what I was so passionate about in school and residency. I came out in the real world and I wasn't finding that. I wasn't finding what I was passionate about. And I think that the position at Western really served as a gateway for me to then explore opening my own private practice and really reaching my potential in a sense when it comes to practicing medical optometry. I wasn't finding that in Florida, but in California, I was really lucky to find it.
You said something very interesting there to me, which was you were drawn to a position, you were unhappy and you were kind of soul searching. You applied to medical school. You're about to go to medical school, quite frankly. You were almost going that route. And then you got pulled into academia and you were enticed by the opportunity to educate the next generation of optometry students. And I see you now, and I see you all the time. You're out and about doing all sorts of lecturing. Do you find that experience at the optometry school, how do you feel like that really fueled your current educational endeavors? Everything that you're doing out and about, whether it's webinars, whether it's in-person lectures, whether it's at, conferences or local societies, like how did that impact you?
I liked teaching OD candidates, and we were mostly in the clinic setting. And I was lucky enough to get experience with first, second, third, fourth years. And I liked being in a position where I was educating and also being forced to keep up with recent literature, which was very akin to what we were doing in residency. So I loved being in the
Hmm.
academic setting. When I left the academic setting and started educating more peer to peer education, I realized that I loved that and still love it much more so than being in a position where I am educating the next generation. I think if I were to be very honest and frank, I love the
Sure.
idea of educating the next generation. I'm not sure if I was necessarily the best fit for it, but I really love being in a position where I'm learning peer to peer and educating peer to peer. And honestly, really feel like I found my passion and have grown into this role. And I'm still growing, which is what I really love about it, because it's challenging in its own ways, and that has helped me grow. And that's what I was looking for, was that growth and the challenge when I came out of residency, and I wasn't necessarily finding it in the path that I had taken previously. And now I just feel like there's no glass ceiling, and I love that there's no glass ceiling, and I can just continue to sort of spread my wings and figure out which aspects of teaching do I want to continue pursuing. And I feel really excited about that.
That's a good feeling to have, isn't it?
Yeah, it really is.
You know,
Keeps you going.
it's funny you say it. I find that very inspirational. And one of the reasons I even started this podcast is I'm just like you. I like to continue to push myself and evolve and figure out ways that I can just grow professionally, personally, professionally. And for what it sounds like, educating students was one thing, and you found out, hey, I like the educational component, but peer to peer is so much more challenging for me. It's more engaging. I feel like I'm always researching the literature. I feel like I'm growing. I'm learning from my peers. And so then you've taken all that, and if you look at your experience, you had optometry school, you had externships, you had jobs in Florida, you had jobs in California, and all of that has turned into what was the launch of your private practice a few years ago. So, what was the tipping point of wanting to open up your own private practice? What did that look like?
I think it was during the pandemic, or just the beginning of the pandemic, when I started exploring the idea of maybe I can, do this advanced dry eye stuff for myself.
Yeah.
I think
Yeah.
when I had initially launched the advanced dry eye clinic for the retina practice I was with, I was very excited about the idea of bringing in new instruments, learning, implementing the protocols, and then finally learning from patients and the patient feedback. And I wanted more of that. And I felt like that glass ceiling I was talking about earlier, I
Hmm.
felt like I was reaching a point where I didn't have enough autonomy, and I thought, I how do I grow this? And I explored different avenues of growing within that practice, and they didn't really work the way that I anticipated. I tried that for about 2-3 years. Quite was quite patient with the process, understanding that it's not my budget, not my financial resources. We have to respect that when we're associates or employees for another practice. Ultimately, it was the autonomy. That's really what was the tipping point. That I said, well, I would love to have experience with XYZ, and it's come to a point where if I don't get this experience, I feel like I'm lagging behind professionally. What's my next step? Where am I going? Can I do this forever? And that's when I realized I've done everything else, and the only other option is to do it for myself. And that was what pushed
Yeah.
me over the edge and fueled me, right?
Well, and it sounds like just based off of your family dynamic too, you have a strong support system in your family. Your husband, I met him; he's very supportive. So I'm sure they fuel the fire, right? So then you're like, okay, I'm going to do this. I'm doing it in California. California is already a challenging state, as I've talked to a lot of our colleagues that practice there. What did that process look like to identify where to practice and go through all the steps that need to take place? And we'll get to the dry eye component because that is like, that's the low hanging fruit for me here because I know you're a dry eye expert. But I'm just really curious, what did that all look like?
I will say that it wasn't easy. There was definitely quite a few challenges. The real estate component, understanding practice management, the financial side of things. Um, my husband has been a huge, huge pillar of support and the person who pushes me and says, try something different, try something you don't know. And I have to definitely give him all the credit when it comes to that. Because I think if I were responsible for my practice completely by myself, I don't necessarily know if I would have gone in the unexplored territories that I now, sort of don't shy away from. And I'm not afraid of exploring those as much as I used to be. Um, I think at first, even just finding a location, understanding the real estate component, are we going to buy? Am I leasing? What does triple net mean in California? And what does that mean for me? And how do I read a lease?
Yeah,
um, it was as optometrists, I mean, nobody's teaching you this, right? Like this is something that you're really learning on the go. So I did hire consultants, and I am so grateful for the direction and the guidance that I received from my consultants. And I think for anybody who's even thinking about it, the one thing that I learned is that the consultants, they must support your vision and your goals. There are consultants out there who might not necessarily, maybe there's a mold and they want to sort of fit you into that mold because they know that
yeah.
this has been the equation for success for their previous practices that they have consulted on. The biggest thing for me was, do they understand that I'm not really trying to set up a traditional optical practice and I really need to get into the weeds with medical billing and dry eye and bringing in advanced technology right from the get-go. That's number one. But then a consultant who's not afraid to say, that's not going to work, or I
Hmm.
don't see how you're going to make that work, and I don't want you to be under the false pretense that that will be successful right from the get-go. So somebody who takes your vision, understands it, but then helps you mold it so that you can be successful. And it has to be that balance of, can I achieve it and can I be successful? And those are not the same thing. Can I achieve it and can I be successful? So I think having that guidance for me was very important right from the get go. There are also some free resources that I came across, like, for example, the California Optometric Association, so the COA, has resources on what are the steps when you open your practice, the legal
Okay.
steps, registering tax board, registering your fictitious name permit, uh, what are the fees, property taxes, things like that. That again, I had no idea. And so there are
No,
some great, yeah, so some great free resources that are available through the state association. But then there are also, consultants available as long as you're on the same page about your vision. I honestly think that that was really important to me right from the get go. And a lot of my initial success was due to having that guidance.
that's huge. And I'm glad you pointed that out. I think the word consultant is pretty broad,
Yes.
especially in our profession. And so there are groups that do it right. There are groups that don't. They may try to, like you said, pop you into their mold, spit it out, don't put in the effort, don't listen and hear what you're looking for. And those aren't the right individuals to partner with. So the fact that you found the right group and kind of leaned into it, and then you had support from your husband, who very smart, savvy guy, right? So that's that he was there cheering you on and getting you in the right direction. That's outstanding. So what did that first year look like? You were learning on the fly so much about business and so much about California law and but clinically, you had to provide patient care. You had to open up and provide patient care. What did that look like? Especially with the mindset, knowing, right, that you wanted to be very heavily medically based,
Yeah, absolutely. Patient care was the easiest of it all. It
right?
was the thing that I could do with my eyes closed. Yeah, yeah. And you hear this quite a bit, right, from practice owners, and you yourself are a practice owner. You run multiple practices actually, and you have to manage employees and HR and payroll. So I know you know this very intimately. The first year, I felt like I just had no boundaries when it came to work life fit. There was just It was always just work, work, work. And that was pretty, I think, daunting and a little bit burdensome at home, um, because I really didn't have a good handle on how much time should I be spending at work and how much of this can I bring home, because my mind, the cogs of the wheels were just constantly churning. How can I make this better? How do I improve this protocol, or how do we address this? We have this type of patient, they're a little bit more difficult. We have this type of patient, they're asking for this. This is how I've done it in my previous clinics, but is that the best way? I need to figure out my own way. So I was not good about setting boundaries right from the get go between work and home. And I think that was really challenging for me, because now I have to start putting those boundaries in for myself. And I think that can be quite challenging. I'm addressing that challenge now. And so that, I think, was challenge number one. And then, as you said, navigating the California law, understanding the different types of taxes. California is tough as a business owner. There's a lot of hands in my pockets, and I don't even know all of whom they are. I just know
My
I get
father-in-law's
bills.
a Yeah, my father-in-law owns a business in California, and he, comes out and visits North Carolina all the time. And he has, real estate assets out here, and he talks about it every single time he visits, just the challenges of some of the just difference in how the states operate and the tax structure. And like you referenced, a lot of hands in your pocket. That's a super huge hurdle. And so you were learning all of that. But I want to dive a little bit more into, because every state's different and there are so many different pieces of red tape that we all have to navigate through. But I want to learn a little bit more about boundaries, because I will tell you, I am just like you. I'm always burning the midnight oil, trying to figure out ways to improve the practice, operations, policies, procedures, making sure that my T's are crossed and my I's are dotted. But eventually you have to have a line in place, personally and professionally. What did you do to figure that out?
Well, I don't have all the answers. I'll tell you that right now. I'm still learning. As the theme of this has been, growth is the constant, right? We're all growing. We're still growing. We're
Yeah.
still learning. Um, I think the first step was recognizing that I was getting very close to burnout, and that
Mm,
I was too involved in a lot of the aspects of the practice that maybe I didn't need to be involved in. So what I'm saying is that I got better at delegating and
hmm
taking things off my plate. That, I think, naturally also came with the more busy we became, the more staff I could hire to actually delegate these tasks to. So the first part of the year, my second year in practice is this year, 2024. And so in January, I started looking at hiring virtual assistants. So I did that for a little bit. Didn't really work for my practice the way that I wanted to, but that was step number one in figuring out how much can I delegate, what can I delegate. I eventually found an in person to help me with that. So I did eventually take off at least 30% off my plate from an administrative standpoint. So that was number one. That way, I wasn't bringing a lot of this stuff home. Also, automating a lot of our processes was really helpful, because it means I don't have to do it and the person I've hired doesn't have to do it. So just using programs like text messaging programs and whatnot was also very helpful. And it helped
hmm
me set that boundary, because I could set automated messages when I was getting text messages and phone calls from patients at 9 p.m. that were initially coming straight to my phone. And they were not emergencies, but more just, can I schedule an appointment? I need a trial for a contact lens, whatever, non emergency requests they were from patients. So setting that boundary where I had, some automated system that helps me filter and understand that this does not have to be addressed right now. But 2 years ago, I would have addressed that at 9 p.m. with that patient. I would have replied right back to them. That was what I
hmm
mean by lack of boundaries. And that was
Yeah.
my fault, and learning that. So those are the two big, I would say, processes that we implemented. And they're still growing. I'm still learning, how much can I delegate to somebody else. Also taking away weekends. We used to work every single Saturday. And so I was on 6 days a week with only one day break. and I cut that. And when I cut that, I realized that my revenue didn't change in any way, not in a negative way at least. And so that was really big for me because now I have 2 days with family at home, not worrying about the practice, not doing administrative things for the practice. So even though these feel like very simple solutions in a sense, I mean, in hindsight, at least, it feels pretty simple. As a cold start, there's a lot of almost aspects of these setting boundaries that maybe felt like luxuries at the beginning, like
Sure.
having enough staff and then having to put that staff on payroll and pay them to do the things where I could convince myself I could just do this for myself and I don't have to pay somebody. But as my burden increases and I get closer to burnout, and I'm now then forced to think about how do I put a boundary in place so that all of this doesn't come down on me. But honestly, the reason I didn't do it from the get-go, and I don't know if in hindsight, if I had to do it again, I probably would still take on quite a bit on my plate at the beginning because I understand the financial ramifications if I don't. Right? So it did honestly feel like a luxury that I couldn't afford.
Well, sure, right? Part of your business plan wasn't hiring a full team of people to support you. It was, hey, maybe it's just me at the beginning. Maybe I add an employee, a half-time employee, a full-time employee, whatever that looks like. Everybody has a little bit of a different roadmap, but no consultant or very few is going to be like, all right, you need a front desk person, a tech, a optician, somebody to help you and be your right hand doing all of these dry eye treatments. That's not feasible unless you come in with your own capital and you're willing to burn through a little bit of it. Doesn't make sense.
Exactly.
I appreciate you though sharing that because I think all of us, right, myself included, learning how to grow within our professionalism, setting boundaries, especially if you're a practice owner, it's challenging. And there are new things that pop up, especially for uh, you know new and even established, even seasoned practice owners, things that you just never knew will pop up, and you have to learn how to navigate it, how to best move forward, no matter the challenge. I want to dive a little bit into though. So you got all the way to this point in the journey. You wanted to do dry eye, like your practice isn't just dry eye though, correct?
That's right. It's full scope. I still
Okay,
love glaucoma, so I still have a very large glaucoma clinic as well.
okay. Why dry eye? Why was it the time for you to kind of double down on the treatment and management of ocular surface disease?
That's a really good question. You know what, Ryan? No one has ever asked me that question, and I really
Well,
love
I,
it.
I just did. Yeah, so let's
Yeah,
do
I
it.
know. It's a really, really good one. Um, so when and I've actually thought about this quite a bit, which is why I'm so excited that you've asked me. So when I was really knee deep in posterior segment and understanding the different treatments, retina, glaucoma, etc. The challenge that I always felt was that my role in managing these patients was eventually quite limited. And quite soon it was limited because then I would have to send out a surgical referral, and then co-management wasn't, usually what I expected it to be, or maybe I would sort of have to take a back seat to that co-management because now this patient is more advanced. Glaucoma management, retina management, let's take the example where they go from dry to wet AMD. Well, there's just not a huge role for me in that if they're getting injections Q4, Q6 weeks. Same with
Mhm.
glaucoma. Yes, I can still manage IOP checks and whatnot, but when it's become surgical, they still need to have their glaucoma surgeon on board, and that's the best for the patient after they've had surgery. And I can just come in maybe, Q6 months, that type of thing. With ocular surface disease, however, I was the doctor initially who was solely responsible for managing their ocular surface disease. And there's just so much within my scope that I have access to, that I can manage. I can treat this patient. This patient can stay in my chair for a very, very long time. And I love that legislation is helping us increase our scope and our access. Now, we're able to perform radio frequency, for example, for dry eye in California, which, wasn't an indication previously that, we had to sort of tiptoe and send to an MD. So I feel like I have a lot more participation in helping my patients feel better. And when they feel improved, their vision improves, psychologically, they improve. And so I can be, it's not like I'm, not their primary, but in a sense, I'm that specialist who has then helped them in more ways than just giving them a pair of glasses or done an IOP check or whatever it is, right? So it's rewarding for the patient to get those treatments on board, but it's really rewarding for me because I get to participate for such a long time.
I love that. And if I've taken anything away from just you as a person from the conversation we've had thus far, you are an opportunist and you love growing. You kind of live by that growth mindset. You thrive off those things. The opportunity just that living in the United States presented, right? The opportunity of opening your own clinic and specializing and then just all the growth that takes place. And so, there's certain facets of optometry where we can be the subject matter experts and we can continue to own that. I will tell you, even since I graduated in 2012, the focus on ocular surface disease has gone up 10x. I mean, it's incredible how much innovation has taken place in the treatment and management of dry eye and ocular surface disease. And we own that. I don't know a lot of ophthalmologists coming out saying, I really want to specialize in this. There are a few, but there
Yeah,
are far more optometrists, right?
agreed.
And so I absolutely love that. If you were listening to this podcast right now, and let's just say you were just getting out of school, or maybe you're in the middle of your career, or even in the back third, what steps would you recommend that these individuals take to open up their own dry eye specialty clinic? Whether it's within a clinic that they don't own, right? Maybe they're an associate and they're trying to pitch this idea, or they have their own clinic, right? Or they're about to launch their own clinic. What are like the first 3 or 4 steps? And I'm not talking all the other administrative stuff aside. Like, what
Yeah.
steps would you do to hit the ground running?
I think first, it's so important to identify the quantity of patients who need your help from an OSD or a dry eye standpoint. And the reason I say that, this is now my business owner mind and my revenue generating mind that comes into this
Sure.
conversation, because you really need to understand, if you can identify, just go into your EMR and figure out how many patients in the past 3 months have I diagnosed with this one ICD-10 code, or how many patients have started treatment for this one ICD-10 code, and take that as a percentage. That's number one. Number two, I think, is really evaluating or reevaluating, how are you even diagnosing dry eye? What equipment do you have to diagnose dry eye? Now, when I first started, I would say slit lamp, your fluorescein, lissamine green, vital dye staining, questionnaires. Those are absolute minimal basics. I would add to that early on mybography. It's really important to have mybography. And my experience has taught me with a specialty dry eye practice, whether it was retina, whether it was my own, because we had mybography at the retina practice as well, is that patients need to see, right? The picture is worth 1,000 words, and patients really need to see the problem, because sometimes they don't feel it. Sometimes it can be an asymptomatic
Mm-hmm.
disease.
Oh
So
yeah.
understanding what diagnostic equipment you have, and then what can you obtain. And nowadays, I mean, like you said, when we graduated, there wasn't a lot in terms of diagnosing dry eye. Like, you would just need your fluorescein green slit lamp, symptoms, and you would treat based off of symptoms. I know so many doctors now who don't treat unless the patient has symptoms. But where does that leave our NK patients where they don't have any symptoms? Where are we doing them a disservice if we're not even treating? Even Demodex blepharitis, not every patient is going to have symptoms with Demodex. Does that mean that we don't treat it? Or does that mean we should take a picture and show the patient and get them on treatment? And now we have treatment for it because we know that it can cause complications. So, understanding your diagnostic need is very important. And then understanding, what is your protocol? So, I'm diagnosing the patient. Is that going to be under the vision plan? Do I bring them back for medical? How do I charge the medical? What medical insurance am I on? Again, this is my business owner mind, right? How am I
Oh
going to get
yeah.
paid for this? Right. And notice those are the first three steps. I didn't talk about IPL, right? Because I don't believe that you need to have an IPL right from the get-go to have a successful dry eye clinic. I think if you're identifying the need, diagnosing appropriately, and then educating your patients with mybography, for example, and you have some sort of protocol in place, some of these other fancy tools, you will naturally evolve into needing those tools because now you've exhausted the resources that you have available, the therapeutics and the punctal plugs and whatnot through medical insurance. And now, naturally, as a fourth step, you'll be looking for, well, what should I bring in next? And I do think that a lot of doctors are under the impression that they need to have some special fancy tool or equipment like IPL to start a dry eye clinic. And then I hear from a lot of doctors that they get frustrated because now I'm not generating enough income, or I thought maybe I was going to generate more income than I am, and I feel hopeless with this machine. And there's a lot of steps before you acquire this fancy equipment.
Love that you said that. And I think that that is such an important thing for us as optometrists to consider. Like, we take care of people and we have really fancy devices, and IPL is one of them. It's incredible. But if you don't have a playbook, if you don't have your protocol in place of how you're going to communicate with the patient, diagnose the condition, educate them on all that's going on, walk them through their options, and then eventually, if those options start to fail, have tiered system to move them up into more advanced therapies, you're not going to be successful with IPL and all these different advanced ocular surface pieces of equipment that you're investing a ton of money on. So you
Yes.
kind of answered my next question, but I'm just curious to hear from you. How do you manage patients that you treat for ocular surface disease where they're just unhappy, right? And like nothing is working. Like, what does that look like in your clinic? I'm sure you have a lot of tiers, like mild, moderate, severe, advanced, but what does that look like?
I think the answer to that question lies in identifying two aspects of the exam. The first one is, are we treating all the comorbidities? So if there's MGD, blepharitis, SPK, staining on the conjunctiva, are we addressing every single one of those findings? Because those findings may or may not necessarily be interrelated to each other. So if we've got staining, let's say we've got superior limbic keratoconjunctivitis superiorly, right? So you pull the eyelid up and you've got that staining pattern. Well, that tells me that there's a friction syndrome. Is the patient a contact lens wearer? Are they getting Botox? Have they had a tight upper bleph? Um, if there's a friction syndrome, are we addressing that appropriately? So that's number one, addressing the comorbidities. And then number two is dry eye masqueraders is a really big topic. Is it only dry eye or is there something else? And there can be more than one thing, but they can be related. So, for example, there was an article that was published where in rat models, they looked at the concurrent occurrence of allergies and allergic conjunctivitis and meibomian gland dysfunction. They found that there was a relationship between the two. So if the patient has a little bit of MGD, but maybe there's an allergy component, are we treating the allergy component appropriately? Or are we just expecting IPL or thermal evacuation of the glands to solve our problem? And then are you communicating that appropriately to the patient? So, if another example would be, and I have a lot of these cases in my clinic where they have, yes, rosacea, ocular rosacea, facial rosacea, meibomian gland dysfunction, but they also have EBMD, epithelial basement membrane dystrophy. So, if we're doing IPL to treat the rosacea and the MGD, are we setting enough of a realistic expectation that maybe the IPL is not going to help with EBMD because it's a different disease process? So I think those two put together could really largely contribute to why a patient is unhappy or that didn't work. It's not that it didn't work, right? It's just that I think that the onus falls on us as the practitioner to really just take a step back and look at those two aspects of the exam more carefully. That's what I found in my practice.
Yeah, I mean, dry eye is multifactorial, right? So there's not a one size fits all solution. Even some of our more advanced solutions, we might get hyper targeted and focused on that, but we need to, as you referenced, take a step back, look at the big picture, and have a good understanding of all that's going on. And are we taking all of that into consideration? Because I think all too often, a lot of optometrists that try to get into dry eye, well, first and foremost, there's a lot that just don't, right? They just throw artificial tears at it and they're like, all right, you're good. Um, but the ones that try to get into it may get frustrated because they don't exactly have the process outlined. And then when they get bottlenecked in that process, they don't know where to go, right? And that's the frustrating point. So I'm sure you even see a lot of referrals. Do you see a lot of referrals to doctors where like they've hit a tipping point? They're like, I need another set of eyes on this?
Absolutely. And I love that type of referral because I'm a huge
Sure.
proponent, just as you started the podcast, right? This pushing the profession forwards. And I love the optometrist to optometrist referrals. And I have a really good couple of handfuls of optometrists in my community who are doing their absolute best with all the tools that they have available, and then finally, and they know what tools I have available, and so finally when they've exhausted, they have great protocols, they have really great treatments in place, and finally when they've exhausted all of those, then they send the patient over for more advanced treatment. And I think that's the best type of referral.
I love it. Yeah. So like in my clinic, we don't have IPL, and it's an advanced treatment that I'm happy to refer out for somebody to evaluate as a solution because it's part of the tiered system and it's a very viable solution. And it's something that doesn't currently fit into just the way that we operate the practice. So for you, you know, you have grown so much in your career. You've gone through so many different interesting components to your journey. What the next 3 to 5 years look like for you? You're going to continue to push yourself. I know that you're going to seize opportunities, but in your head, what does that look like to you? What does good look like in the next 3 to 5 years?
That's a great thought-provoking question. One I haven't thought about, but probably should have. I love being so involved in peer-to-peer education. So I definitely see myself continuing along that journey. And in terms of the dry eye, I think the next step. So my clinic currently has it's full scope. We do comprehensive exams, we do dry eye, we do glaucoma, sort of everything. But we have a specific focus on dry eye. And the next step for me is to build out a dry eye only clinic. So I have, at the beginning of the year, I was very interested, let's say, and motivated in building out aesthetics. Now, I live in Los Angeles and everybody is doing aesthetics. And
You
there's,
don't
well,
say.
yeah.
Little access to Hollywood, and yeah, I get that.
Yeah, exactly. And even in the tiny towns that are away from Hollywood, there's four med spas and they're all doing the same thing. And I appreciate that there's a specific, I would say, niche market that's maybe available for ocular aesthetics. But I don't necessarily know if we're at that point where society is ready to accept ocular aesthetics separate from facial aesthetics, if that makes sense. And if anywhere in the world it would be accepted, it would be accepted here first in Los Angeles, because I feel like we are just eons ahead of the game when it comes to how established aesthetics is here. So I think that part of the dry eye clinic would be that we would have a small section that's niche specifically for ocular aesthetics, where we, sort of go through the proper channels of having a medical director, etc. And even though we explored it as an option for my current practice, I decided to put that on hold because it didn't really feel like the right fit in the right setting. But with a dry eye only clinic, that's what that looks like for me. So continuing to professionally grow, but then also building out a separate dry eye only plus or minus aesthetics.
Well, I've seen, a number of our peers start to, and some are fully embracing that. And you're somebody I know that would knock that out of the park. It's not if, but when. And so I'm excited for you about that. How about personally, you have a family here in the country with three siblings, right? And then you have your husband. Like, what are some things that you like to do for fun, and some things that, like, when you have that boundary up, you can just let loose and enjoy?
Oh, I love to read. I like to be in my bubble, and I love to read. When it comes to family time, honestly, anything. I love visiting Asheville. I have family there. My sister, my brother-in-law, my 5-year-old nephew now is 5.
Aw.
And we love going to the Biltmore and exploring with the animals and taking trail walks at the Arboretum. We do that here in LA. So I love being outside. The weather is obviously more amenable over there in Western North Carolina than it is out here in LA, where sometimes it's 105 degrees and you don't want to do anything outside. But I love being with, just being with the family and just sort of being in the moment with the family, and that could be a movie inside, that could be a trail outside. And then my reading has shifted, where now I'm trying to strike a good balance between reading for work and reading for leisure. And I love historical fiction. So I really am trying to find a good balance now where I can read about both, and also taxes because LA.
And listen, if you're an avid reader, you're already much stronger in that component than me. I like to read. I'm more of a podcast guy, and then, but like, to find the time with a five. My son's turning 5 in the spring, and my daughter's 7, and then running the business, and then all the other facets. Um, you're already a step ahead of me in that game. That's for sure. One final question for you, and then, of course, I'd love for everybody to know how they can further connect with you. You know, the premises of this podcast is to provide enlightenment, right? To provide a roadmap, to provide positivity to those that are trying to embark in certain aspects of optometry. If somebody were to learn from your journey, particularly how you've come to launching your own private practice and then doubling down on a specific niche, right? Ocular surface disease and dry eye management. What is one takeaway that you want somebody who's listening to this right now to just kind of hammer home?
I think the one big thing is I would encourage someone to explore what is unexplored for you. And I I I think that I would encourage that someone to think outside of the box that you have previously thought in. And if that territory seems to be a road that you want to take, then explore that road, and do yourself do it justice. Really fully explore it. And yes, you can be afraid. I'm not going to say don't be afraid to explore. I say be afraid. Because with fear will come growth, and it's okay to be afraid. And fully explore it, and really just do it to your heart's content. And when you start to get red flags that this is not for me, then leave it alone and find a different route. But I think that exploring the unexplored territory and thinking outside of your box to really figure out what you want is the path forward. And that was the path forward for me. And I do believe that we eventually get there, where we think, how can this be better? Sometimes that comes professionally, sometimes that comes personally, sometimes it's both, sometimes it's at the same time, sometimes it's not at the same time. But that would be the one thing I would say.
Very well said. And it's been a pleasure having you on today's podcast. For anybody who wants to further connect with you, how can they best do so?
um, my Instagram at dr.hardeep.kataria, or my email, kataria.hardeep@gmail. Those are the best two ways to connect with me. And I really appreciate the invite to come and speak to you about my journey. I loved all these questions, some of them more thought provoking than I anticipated. You really made me work at 6 p.m. Tuesday night. My brain's still going. And I'm just really proud of everything that you've achieved, starting with Ryan Reflects, and now we the blog, and now we have the podcast, and I'm really excited to see where it goes. And you're just awesome. I think the world of you. So thank you for having me.
You are way too kind. I really appreciate all the kind words and sentiments. And I think I'm going to wrap it up with that. I look forward to seeing you in Asheville when you come visit your family next. And I'm just going to say, for anybody listening, make sure you subscribe to the podcast, hit that like button, share it amongst any of your friends, and stay tuned for my next podcast where we can reflect and grow stronger together.